Leishmaniasis infection. Introduction.
Leishmaniasis is an infectious disease spread by the bite of infected sandflies. It is also known as Kala azar. The infection can cause ugly skin sores if not treated. Internal infections can happen and are more serious. Leishmaniasis can be treated, however, it is better to prevent it before it happens. This patient education tutorial discusses Leishmaniasis infections, their symptoms, diagnosis, treatment, and prevention. What is Leishmaniasis? Leishmaniasis infection is caused by the Leishmania parasite, a microscopic animal that can live inside sandflies. Infected sandflies can bite people and give them the Leishmania parasite, which results in the disease Leishmaniasis. Sandflies are very small and may be hard to see. They are only about 1/3 the size of typical mosquitoes. They fly without making any noise. Sandflies become infected with the parasite by biting an infected animal, such as a rodent, a dog, or biting an infected person. The infected sandflies can then spread the parasite by biting other animals and people. Rarely, Leishmaniasis is spread from a pregnant woman to her baby. Blood transfusions or contaminated needles also can spread Leishmaniasis. There are different types of Leishmaniasis. The most common form causes skin sores and is called cutaneous Leishmaniasis. Another type is called visceral Leishmaniasis because it affects some of the internal organs of the body, such as the spleen, liver, or bone marrow. The visceral type is more dangerous than the cutaneous type, but it is more rare. Symptoms and risks. People with cutaneous Leishmaniasis usually develop skin sores within a few weeks of being bitten. Sometimes it takes months to develop the skin sores. People with visceral Leishmaniasis usually become sick within several months of being bitten. Rarely it may take years to develop the symptoms. People who have cutaneous Leishmaniasis have one or more sores on their skin. The sores can change in size and appearance over time. They often end up looking somewhat like a volcano with a raised edge and a central crater. A scab covers some sores. The sores can be painless or painful. Some people have swollen glands near the sores. For example, the glands under the arm can swell if the sores are on the arm or hand. The skin sores of cutaneous Leishmaniasis will heal by themselves, but this can take months or even years. The sores can leave ugly scars. Visceral Leishmaniasis causes chronic exhaustion, brought on by fever, weight loss, swelling of the spleen and liver, and anemia. If not treated, visceral Leishmaniasis kills the patient. Occurrence.